reopen or not to reopen? That is a question that starts off a new week of our down the middle coverage on CNN 10. I'm Carl Azuz. Late last week, the Trump administration issued new guidelines for how the U.S. could reduce restrictions on where people can go and what they can do. It's a three-phase approach. It would start with certain businesses allowing employees to return in limited numbers, and it would eventually lead to schools, gyms, and stadiums being allowed to completely reopen. But these are federal suggestions, not federal law. And President Donald Trump says it'll be up to individual states to decide what to open back up and when. Those decisions will depend on how many coronavirus cases they have and how equipped they are to deal with them. In New York, for instance, there have been more than 240,000 cases of COVID-19, but states like Maine, Montana, and Wyoming have each recorded fewer than 1,000 cases. Many governors and health officials say testing is key to knowing who's spreading the virus and that there's still not enough of that being done across America. President Trump says his administration's working to increase testing and that the U.S. has tested more people than any other country. There have been protests in several states with people asking their governors to open things back up. One organizer says small businesses are being destroyed under the lockdowns. On the other hand, health officials have said the state closures and social distancing laws have been effective in preventing COVID-19 from spreading. So the debate pits economic concerns against health guidelines. And because the disease isn't spread evenly across America, there's no one clear policy that can be applied nationwide. In terms of testing and tracking coronavirus, South Korea has a variety of tools it uses, but critics say what it costs in privacy is enormous.
A patient tests positive for the coronavirus. Time is critical to trace where they have been and who they've seen. South Korea says it can access that information in as little as 10 minutes.
If I was confirmed with coronavirus, what would you do then?
조사가 필요한 대상자.
We put in the mobile phone number, the credit card number, set the time period, and all the information we need appears in our system.
Your location from at least 2 days before you noticed you had symptoms, how long you spent in each place, how busy the area might have been. Mobile emergency alerts are then sent out to the public, sometimes 6 or 7 a day, telling you about cases in your area. It wasn't always this fast. The KCDC says it took up to 48 hours to get the same information 5 years ago during the MERS outbreak. Criticism of a slow response at the time led to the law being changed. So officials can now use patient statements, mobile records, credit card transactions, CCTV footage for an accurate tracing of transmission.
One recent example in my neighbourhood shows just how much detail is being shared with the public by both the government and local businesses. For example, I know the exact locations this individual went to. I know the door that they used in order to get inside my local supermarket. I even know that they bought dried chili peppers at the self-checkout.
So could this model be used elsewhere?
This is not advanced technology. The difference is, will other countries have laws allowing them to use this personal information?
There are plenty of coronavirus apps here, a map showing every case in your neighbourhood and around the country, started by students, adopted by the government, and an app showing which pharmacies currently have masks in stock. But the government says it is this system, using big data to track citizens who tested positive, that has been the key first step in their policy of trace, test, treat. Paula Hancock's CNN Seoul.
10-second trivia. Who are Thomas Marshburn, Jessica Meir, and Andrew Morgan? Are they all Shark Tank stars, Federal Reserve leaders, British royals, or NASA astronauts? All three of these people have spent time in space as NASA astronauts.
It is quite surreal for us to see this whole situation unfolding on the planet below. We can tell you that the Earth still looks just as stunning as always from up here, so it's difficult to believe all the changes that have taken place since both of us have been up here. It's going to be kind of like a planes, trains, and automobiles scenario where I think we're going to even end up riding in an ambulance for several hours across the Kazakh steppe in order to get to our airplane. So it'll be a little bit different than normal, but this is the first time landing for both me and my crewmate Drew Morgan, so we don't really have anything to compare it to. It'll just be the way that it is for us.
Veterans across America are once again answering the call to serve, this time in the fight against coronavirus. Team Rubicon, a disaster response organization, is among the nonprofits mobilizing their volunteers. It's made up of veterans. Some are helping with large-scale efforts, some are doing the grocery shopping for elderly neighbors. Team Rubicon's founder is a CNN hero.
The coronavirus is pushing healthcare workers and first responders to their limits.
But they're good.
But volunteers are also stepping up to help those in need. One of those is 2012 CNN hero Jake Wood, a former Marine who served in Iraq and Afghanistan. For the last 10 years, Jake's nonprofit, Team Rubicon, has deployed veterans in response to more than 500 natural and humanitarian disasters. It started with the 2010 earthquake in Haiti.
Let's get our gauzes, let's get our Chlorhex.
When Jake led dozens of veterans
I'm gonna go through and I'm gonna number the beds.
on a mission to help.
You match up the name to the mills.
Now Jake's group is mobilizing its 100,000 volunteers to respond to the COVID-19 crisis across the country.
Is there anything else we can do for you?
That's it.
Team Rubicon has launched a nationwide Neighbors Helping Neighbors campaign. Our volunteers are going in to supply much needed volunteer assistance in operations, logistics, and the execution of food delivery for vulnerable populations.
How you doing, okay?
Assisting organizations like Feeding America and Meals on Wheels.
This food will all be used and maybe redispersed to different soup kitchens, nursing homes. I'm very fortunate to be able to be a part of all this.
We're also helping to establish testing and screening sites in collaboration with major healthcare systems.
RNs on both, 4 EMTs on both.
Soon we'll be operating a 250-bed federal medical station in Santa Clara, California.
We can't do this mission if we put ourselves at risk.
Safety has to be the #1 priority. It's really important that we follow established guidelines and protocols so that we're not contributing to the problem.
I got some meals for you, right?
Yes, sir.
It's all work that Jake believes veterans are uniquely suited for.
These are men and women who have volunteered to serve in harm's way before. They may have taken the uniform off, but they still have service in their hearts. They still have those incredible skills.
Couple bags.
And in times like this, we should be turning to the veterans in our communities.
But Jake wants to help all Americans make a difference in their communities, regardless of whether or not they've served in the military.
But they're good.
We are hoping that Neighbors Helping Neighbors can become a nationwide call to action for all members of our society. If you're at home and you want to pitch in, go to teamrubiconusa.org/neighbors and find out all the ways that you might be able to get involved with our organization.
I'm here because we're all in this together. We're trying to meet the need where we can.
To be able to help a little bit fills my heart.
Stay together.
Here's the newspaper.
This is about your community. This is a moment for all Americans to rise to the occasion by thinking about the greater good. We will get through this together because that's what Americans do best.
You're welcome. Bye-bye now.
Gyms closed, many national parks are closed. Unless you happen to have your own granite outcropping, there are just not that many places to go rock climbing. So an arborist went into an old barn and built his own. It took Noah Peck about 3 days to construct a wall he could scale. He uses old tree stumps to fashion new climbing handholds. And while most people stop when they hit the wall, that's where Peck gets started on his workouts. So Noah packed a great way to stay in shape, and it's easy to see how he got roped into it. Oh sure, some might lay back or choose to belay around all day, but climbers tend to be bolder than that. The very idea repels Noah. They're not afraid to take up a mantle that totally rocks. I'm Carl Azus. The American International School of Egypt totally rocks. Thank you for watching from Cairo. We'll see you tomorrow on CNN.